Mr. Speaker, last year AHS announced restructuring plans to engage frontline workers and allow for more local decision-making. But the latest numbers tell the story of another government failure. Staff engagement numbers show that only 1 in 2 are proud to even be associated with AHS, while physician engagement sits even lower at 39%. But now the new board chair wants to try again with a hospital empowering pilot project at the Rocky View General. My questions are all to the Minister of Health. Given your history of your expanding bureaucracy and ignoring the cries of our frontline staff, how will you ensure that his project doesn't also fail miserably?
Honourable Minister.
Well, Mr. Speaker, the honourable member is correct in that the newly appointed board chair of Alberta Health Services has talked about his desire and that of the board to do a better job of supporting healthcare workers, and that includes both physicians and other workers that deliver care. One of the strategies to approach this, Mr. Speaker, that has been discussed with me and which I support, is to give, to the greatest extent possible, local healthcare workers better tools to support operational decision-making on a day-to-day basis. That means engaging staff in meaningful discussion about new strategies. It means allowing basic funding decisions to be made at a unit level. And it means, in general, Mr. Speaker, empowering those workers to deliver the quality of care that they want to deliver.
Mr. Speaker, given that when Stephen Lockwood took the helm of the AHS board last month, the Minister of Health, that's you, Minister, shot down any hope for real change by saying, "We're committed," that's your quote, not mine, "we're committed to the system we have in place." Are we to believe that you'll now adopt the Wild Rose policy of localized decision-making? Or will you continue to resist those meaningful and necessary changes that you're now hearing from your new board chair?
Honourable Minister.
Well, Mr. Speaker, the position of this government, and a year ago, and the position of this government today, is that we are absolutely not interested in restructuring, reorganizing, or otherwise making changes that will disrupt the efficient delivery of health care. That does not mean, Mr. Speaker, that we are not interested in ensuring that local administrators and people that deliver care to us on a day-to-day basis do not have the tools that they need in order to do their job. That means, Mr. Speaker, listening rather than talking, focusing on positive outcomes, and there are a list of many that we could discuss in this House that have been achieved by Alberta Health Services, and recognizing local success and giving credit where it is due.
Minister, you failed miserably on listening. Let me put you back to your own Alberta Health Act. Given that the national benchmark for physician engagement sits at 76%, while Alberta scores at barely half that number, will you admit you have failed doctors by not including the issue of bullying and intimidation in the health inquiry?
Mr. Speaker, the failure that needs to be discussed in this House is the failure of this honourable member and her colleagues to refrain from the negativity, cynicism and personal attacks with respect to our healthcare system that result in these kinds of attitudes. The fact of the matter is, Mr. Speaker, that satisfaction figures are slowly increasing within Alberta Health Services. We have admitted as a government that it was a very large change that took place over a relatively short period of time. Everyone, from the board on down, Mr. Speaker, is actively involved in finding new and more meaningful ways to engage workers, and they are delivering results for Albertans.